Discouraged by the results and opposed to the invasive and toxic nature of the treatments utilized by mainstream practitioners, certain physicians and clinicians specializing in mental health began to look for alternatives to the excesses of traditional drugs.
There's a new paradigm emerging in the field of mental health. People who are mentally ill, who've been told that they will be mentally ill for the rest of their life, can in fact heal their lifelong depression and severe anxiety. The new research that Western medical science and alternative medicine is offering is incredibly hopeful.
One of these alternative approaches is called orthomolecular psychiatry. The term orthomolecular was coined by Nobel Prize laureate Linus Pauling and refers to the correction of imbalances within the body through the use of vitamins, minerals, amino acids, and other naturally occurring nutrients. Orthomolecular physicians believe that with these substances there is less of a chance of harmful side effects and a greater potential for cure.
Because there's been an increase in disorders like depression over the last 80 years, in fact, every generation for the last 80 years has experienced an increase in depression over the previous generation. There's been a real interest as to whether or not diet might have anything to do with this particular change.
Food is not like a drug, and it has a much deeper effect than any drug you might take. So paying attention to what we eat every single day is going to be really important in our general overall health.
Orthomolecular clinicians view depression or any other illness as a unique and individual condition.
We shouldn't think of traditional versus alternative, but ways of combining these two so that you can really have your cake and eat it too, so that you can have the best of both worlds.
Depressed people are continually negative. They have dark thoughts and guilt and feelings and grief and regrets. Such negative thoughts are characteristic of depression.
According to Carl Jung, we can only live in the light by constantly being aware of where our shadow is. So it's no good to deny our real feelings.
I think the antidote to depression is the courage to change. That really is what it's all about.
Hi everyone, I'm Gary Null. In part one of our special program on natural approaches to depression and anxiety, we explored the orthodox and alternative perspective on what causes these conditions. In part two, we're now going to take you on a journey of natural treatments for depression and anxiety, something that's going to impact upon the lives of so many suffering Americans.
I think mainstream medicine is coming around to the fact that there may be some value in these alternative methods, and that they don't really have to look at them as a threat to standard medication. We're all physicians and we all have the interest of our patients in mind, and if something works, it works, whether it's backed by a major drug company or, you know, it's a mushroom in the field of some farmer in China. It really should not make a difference if it has efficacy.
Now, in some situations, you might want to use both. You might want to improve the immediate symptoms, and you don't have the luxury and the time to get to the deeper issues. So sure, in those situations, you treat superficially and you use whatever you have available to alleviate suffering. That might mean St. John's wort. It might mean kava kava. It also might mean Prozac or Paxil or Zoloft. You really have to evaluate each person individually and be open-minded.
Take that Prozac and its cousins. It's called an SSRI, a selective serotonin reuptake inhibitor. Pretty impressive language. SSRI is easier to say. And they have determined that we need more serotonin, so by putting in something that inhibits the uptake, it keeps the serotonin active longer. It works. But we can increase the serotonin by giving the natural precursor in the body, which is tryptophan or 5-hydroxytryptophan together with some vitamins. And we believe that that's a much healthier way to modify serotonin. That's the way that the body was designed to work.
Many of us know people who are on drugs who continue to be depressed. And the research about placebos is absolutely astounding. Mega studies of placebo research show that when a person has major depression, about 67% of the time, antidepressants will offer some relief. Well, you may say 67%, that's pretty good. Of those people, 15 to 50% would have gotten relief from placebo, and another 33% get no relief whatsoever. Also, recent research about antidepressants, why antidepressants don't work for many people, shows that people who are not getting relief from antidepressants are often not getting glucose to the middle part of the brain where emotions are processed. So we've got to start listening to nutritionists. We've got to start listening to the orthomolecular psychiatrists, because the drugs are often not working, and they're not working for nutritional reasons.
Our diet not only plays an important role in good health, it can also negatively impact emotions and result in depression. Often, a person who's depressed does not eat right. If the depression is profound, the individual doesn't feel like eating. They're apt to restrict their nutrition to fast foods or just anything to get eating over with. In many cases, weight loss is a symptom of severe depression. In many other cases, there's a substantial weight gain. Significant weight loss is likely to bring about marked deprivation of the essential nutrients, including the amino acids needed to manufacture the proper proteins to allow the brain to function.
Neurotransmitters are usually amino acids, and amino acids are derived from the diet from proteins. So persons with depression may not get enough amino acids in their diet, or might eat plenty of proteins and not break down the proteins to amino acids, and in either case may not have what are known as the precursors. In other words, the amino acids to form chemicals like serotonin, resulting in depressive types of symptoms.
These neurotransmitters belong to a chemical group called amines, which are responsible for the control of emotions, sleep, pain, and many involuntary body functions, such as digestion. Almost 90% of these amines are found deep in the brain, and because of their importance, the normally functioning body has developed a recycling system called reuptake, by which the nerve cell takes back 85% of the neurotransmitter for future use once the chemical reaction has been completed. Only the remaining 15% is destroyed by enzymes. The metabolism of the neurotransmitters is intricate, and deficiencies can occur for many reasons. Genetics, aging, poor diet, or deficiency of the amino acids, vitamins, and minerals that make up amines may be the culprit here.
There are several amino acids that are critical. One of those in particular is called tryptophan, or what you may hear of recently as 5-hydroxytryptophan. The tryptophan is converted into the transmitter called serotonin. Now, of course, all of the new antidepressant drugs, or many of them, are based on altering the serotonin system in some way. And really, if you have a deficiency of tryptophan, the body can't make enough serotonin. So this amino acid has been used in the management of depression, although the FDA has made it difficult to utilize over the counter. Another amino acid is called tyrosine, which goes into another series of brain metabolic pathways. And tyrosine has been used therapeutically in different forms of depression and sometimes in anxiety as well.
If you just take tryptophan by itself, it's not nearly as effective as when you take it with the necessary cofactors like B6, redoxyl 5-phosphate, and niacinamide. I believe that that is even more effective than taking 5-hydroxytryptophan. Sometimes 5-hydroxytryptophan is associated with adverse side effects like anxiety and other strange symptoms, possibly because the 5-hydroxytryptophan gets attach to other neurons that are even not involved in serotonin. So we're not really sure why 5-hydroxytryptophan is not as effective as we thought it would be. But I often recommend tryptophan with its cofactors.
When we look at it and we say, do we have satiation depression with just low serotonin? In that situation, remedy for that would be 5-HTP, because that specifically increases serotonin. Now, St. John's wort wouldn't be good for that because it also increases dopamine. And it's especially contraindicated in someone who has anxious depression because St. John's wort, again, increases serotonin and dopamine. Now, on the other hand, if you have the depression that is due to low serotonin and dopamine, St. John's wort would be better than 5-HTP. So when we look at nutritional factors, which is one method of treating, we need to be specific to use the specific herbal remedy for the specific type of problem.
A diet centered on raw, fresh vegetables and fruits, and a balance of proteins is recommended to ensure that proper amounts of amino acids necessary for proper brain functioning are ingested.
Amino acids should be, in my opinion, a mainstay basic therapy for all mental emotional disorders, particularly depression and anxiety. A simple blood test can be performed where a person's individual need for amino acids could be assessed, and an amino acid powder could be made up which matches their exact chemistry.
One of the things that we really encourage people who have a serotonin type depression, which is almost everyone, it's just do they have the other components, is 2 hours after the highest protein meal is when you snack on a complex carbohydrate. You don't add those additional calories, you just snack on it, because that'll help take the amino acids that go to serotonin and drive them into the brain, because there's no competition. So that 2 hours afterwards is a very key timing. It helps the next day.
A problem in getting the depressed person to eat healthfully is to overcome the feeling of not wanting to be bothered thinking about diet or not having the energy to prepare a nutritious meal. One suggestion is to make easy meals in quantity once a week. A large amount of salad, for instance, can be stored in the refrigerator. This will help an individual to eat wholesome food for several days without too much fuss.
When you eat, the mind has to be in a certain state. Eating on the run, convenience foods, fast foods, snack foods, all the way we eat foods is the biggest problem.
Nature provides a lot of natural antidepressant properties, called phytochemicals, in many of the most common foods, such as parsnips, acerola, lettuce, endive, spinach, Chinese cabbage, broccoli, tomatoes, oats, radish, dill, black beans. All are good sources of natural antidepressant nutrients.
Among the vegetables that you could consider for your diet are the sea vegetables. The sea vegetables are very rich in minerals, including calcium, and also rich in iodine, which can help some people who have thyroid problems. In acute cases of depression, when you feel you're really in a bad slump and you need to pull out of it really quickly, here's another one of my favorite remedies. These are the famous in Japan, Umeboshi Plums. This is what it looks like. And the way to take it, very simply, is you can do it with a spoon, or you can just stick your pinky in it, just take a lick and lick it. And this has been known to work in minutes to get people out of a slump of unhappiness. I had somebody once who was suicidal, and for no particular reason, and I had to take some umeboshi, and she was out of that mood very quickly. So I recommend it highly.
It goes without saying that lifeless processed foods, such as devitalized white bread, should not be eaten. Hard to digest and toxic foods such as meat, dairy, and processed foods, sugar and alcohol, and caffeine should also be avoided. These create an imbalance and remove energy instead of creating it. Meat consumption can result in sleep disturbances, anger, and irritation, and alcohol damages the brain.
Hypoglycemia remains today a major trigger for anxiety, depression, and fatigue. High sugar and high caffeine over and over again through the day precipitates the body into a roller coaster, what I call a sugar chute, where the level of sugar goes up and then crashes and produces a reaction in the hormones of the body, and that results in major symptoms.
One of the best things to do is to get rid of dairy foods and to get rid of wheat, especially white flour, and to replace the dairy. Everybody wants to know about the calcium. The way to replace the dairy is to eat more green vegetables, which is really where milk comes from. Milk is vegetables that went through the cow. So when you stop using the milk products, you go straight to the vegetables themselves, which makes a lot more sense. And simply changing your diet in this manner can make a big change in your moods.
The orthomolecular clinician is also concerned with uncovering sensitivities to foods and chemicals, environmental pollutants, electromagnetic fields that may affect the patient's behavior adversely, even cellular phones, because they create a hotspot on the brain which can affect behavior. And since this approach is based essentially on nutritional rebalancing, it is non-toxic, safe, and usually does not entail adjusting drug therapies. Dr. Warren Levin studied the effects of food allergies, nutrition, vitamins, minerals, amino acids, herbs, all in the treatment of such conditions as depression and anxiety.
The idea that the brain can be an allergic reacting organ is not taught in medical school, and it's a critically important issue for people with emotional, mental problems. Food allergies are generally thought of as acute reactions. If you eat shrimp, you break out in hives. If you eat strawberries, you get a runny nose. But those are relatively rare forms of food allergy. Most food allergy is a delayed allergy and very difficult to correlate without very careful history taking and instruction of the patient in how to recognize this perplexing delayed allergy response. Again, there is a relationship to the high sugar diet, because the high sugar diet tends to encourage the growth of the candida organism, and when that's superimposed on frequent antibiotics, as is so true in children today, the organism is allowed to grow rampant because the competing organisms, which are healthy bacteria in the intestinal tract, are destroyed, whether we like it or not, when we give an antibiotic for a strep throat or an ear infection. And that leaves a place for the yeast organisms to grow in the intestine. And as they grow and produce their waste products in the intestinal tract, they are absorbed, and people become allergic initially to the waste products and toxic from them as well, and eventually to the organism itself. I'm sure that listening to all of this theoretical talk is of some interest, but I know that there's nothing like hearing a real human person's story. And I'm really very indebted to one of my patients, Rebecca, a teenager who had what I think is a terrible experience because of the misunderstanding of the mainstream psychiatry as to the meaning of symptoms and the treatment for a label, a diagnosis, rather than a cause.
Before I went to see Dr. Levin, I spent 2 years going in and out of hospitals. I was on all sorts of medications that did not help. I would be put on a medication for depression, and they'd say, wait 2 weeks, it'll help in 2 weeks. It never helped. And I went on like that for about 2 years. And I had been on all the antidepressants they had, except for one, and none of them would help me. So they said I had to go for electric shock treatment, which we didn't want to do.
She was on Zoloft, Prozac, lithium, Depakote, Ativan, Buspar, just to name a few of them, and nothing really seemed to help her. And the side effects that she had from the medication were pretty awful. They gave her tremendous dizziness, headaches, about a 60-pound weight gain.
We found that she had a major problem with a chronic candida infection, the associated allergies, and particularly the food allergies. She needed vitamins and minerals. Initially, we gave them to her intravenously.
I feel like a completely different person. I'm more outgoing. I have a job now. I'm getting to drive. And I'm having fun. I'm enjoying things now. And I'm able to more stand up for myself more and just enjoy life.
Yeah, she started singing again in about 3 weeks. It took about 3 weeks for us to hear her singing again, and we knew that she was much, much better then.
Nutritional status plays a key role in how we feel emotionally, and there are many recommended supplements one could take to optimize that. You simply have to appreciate that the brain functions directly based upon the amount of nutrients it's given.
We talk about the complex subject of brain chemistry, and really when we get down to the basics of that, what we're talking about is nutrients, because things like amino acids, vitamins, minerals, and cofactors, and fatty acids really drive all the biochemical processes in the brain. And one of the factors that people are really unaware of is that the brain is actually made up of about 60% fat, with some parts being as high as 75% fat. So when we look at nutrients, we find that this particular family of nutrients, the fatty acids, actually form the structure or the architecture of the brain. And so we have a lot of evidence now building that shows that changes in the fatty acid intake, for example, can change the brain's structure and therefore can change the brain's function. The omega-6 fatty acids are in the oils such as sunflower, safflower, sesame, and corn oil. These are very prevalent in our diets. And they're also found in animal flesh. The omega-3 oils are typically in things like flax oil, walnut oil, pumpkin seeds, and cold water fish such as salmon, mackerel, herring, and sardines. Our diets are not as abundant in these particular fatty acids. And these fatty acids appear to be critical. We seem to need them in about a 1-to-1 ratio. Now, the most important omega-6 fatty acid in the brain is arachidonic acid, which comes primarily from animal protein and animal fat. And arachidonic acid seems to be a bit too prevalent in our diet. So it's balancing our intake of this omega-6 fatty acid with the omega-3 fatty acids from the cold water fish and the cold water plants such as flax and walnut and pumpkin seeds. And the most important omega-3 is called DHA, or docosahexaenoic acid, and this is found in the cold water fish. Now, the balance of these two seem to be critical for the functioning of the brain, and they've been used with some very, very interesting success in the management of a large spectrum of mood disorders, including anxiety and depression. But again, it's really the balance between the saturated fats that you find in butter, for example, and the unsaturated fat that you find in vegetable oils and fish. And we can add to another one here the fats in things like olive oil, the so-called oleic acid, which we find in olive oil and hazelnut oil. This is an important component of the brain as well. The myelin sheath, which surrounds the nerve cells, requires oleic acid that we find in olive oil. So this perhaps should be one of the principal oils in our diet. As we've seen in the Mediterranean diet, those individuals are very healthy. They have a low incidence of heart disease. And I believe, and I think many would agree, that oleic acid from something like olive oil should be one of the principal fatty acids in the diet.
We now know that a substance called phosphatidylserine, which is an endogenous substance, it's found within the body, that this substance has been shown to actually improve the hypothalamus pituitary adrenal axis, that hormonal axis from the hypothalamus in the brain to the pituitary in the brain to the adrenal gland. That axis is improved with phosphatidylserine. Now, when you, the improvement results in a lowered cortisol level. The lowered cortisol level will in turn cause an improvement in one's psychological state and also one's cognitive state as well.
If DHEA is found to be low, it needs to be supplemented in most occasions. If cortisol is found to be low, which is common with anxiety, we can use licorice to reduce the body's degradation of cortisol. Then the body's own cortisol is maintained in circulation longer. Or, in some cases, if the cortisol is too low, cortisol augmentation therapy can be used. Cortisol can be taken in supplemental form.
Siberian ginseng could be a very important factor in the total protocol for those with anxiety. Siberian ginseng tends to have a calming effect upon the sympathetic nervous system, which is that part of the nervous system which is responsible for the fight or flight response, which is that response which raises our blood pressure and accelerates our heart rate and our pulse rate and causes sweating, all of the typical symptoms of anxiety. So it's thought that those with anxiety actually suffer from a stress response all the time, or much of the time. So anything that can be used to help modify that stress response could be useful, and Siberian ginseng can definitely have that effect.
Studies have shown again and again that there is a relationship between nutrition and depression, particularly in geriatric patients whose ability to absorb nutrients from their diet may be compromised even if the diet itself is acceptable. Specifically, a link with amelioration of depression symptoms has been established regarding vitamins B1, B2, B6, zinc, and the elimination of caffeine and sugar. Other nutrients that enhance brain function would include acetyl L-carnitine. This nutrient crosses the blood-brain barrier and provides the brain with more energy. This is a gentle, not jittery energy, and it's especially important for older people who tend to lose brain cells due to a lack of energy.
The B vitamin biotin has been shown often to be helpful in case of depression. You could do blood tests to confirm a deficiency or do a dietary history. All you need are minuscule dosages, 100 to 300 micrograms of biotin. Other B vitamins can also be involved in depression. Vitamin B12 can be cause of depression in the absence of even anemia, which people don't realize. You can put people on B12 and their depression may improve.
Pantothenic acid, or B5, is known to enhance one's response to stress, and those with depression don't seem to have a normal stress response, and that would enhance adrenal function and one's ability to deal with external triggers for depression. B2, for example, has an impact upon depression by increasing nervous system function and actually enhancing the ability of neurotransmitters to work in the brain. Niacin or B3 could help symptoms such as depression, anxiety, mania, many of the common symptoms associated with depression. So in general, anyone should consume a balance of B vitamins, but those with depression seem to have higher levels than the average person just to maintain normal emotional states.
Calcium can be awful helpful in depression, especially in the elderly people, people that are postmenopausal, women of childbearing period can often become deficient in calcium. You add calcium to their program and their depression can be alleviated. Magnesium also has been helpful in depression, and also you have to look out for hyper, which is too much magnesium in the body, has sometimes been associated with depression. Today, many people do self-supplementation, and it's possible for them to become have an excess of magnesium. Another element called vanadium has been associated with.
There are various liquid mineral complexes that literally, if you were to add them to water, they could carry an electrical charge that could light a light bulb. And in giving such mineral mixes to the right person, you'll find it'll just change your life around. And people are mineral depleted, of course, because of the food supply, because of mineral depletion from the type of diet that most Americans are on.
Another supplement that I use, not in all people, only after careful evaluation, is a relatively new natural substance called NADH. And NADH is a natural substance found within the cells, within the mitochondria of the cells, and it's involved in energy production. Now, when you improve the energy production of the brain, it works better. And not only will you improve cognitive function, but you're also going to alleviate depression. So it's quite an interesting substance, and I think that it's going to be used much more commonly in the near future. I think that it might even be more effective than St. John's wort, although there are no studies to compare the two. But again, it has to be in high dosages, often in 5 milligrams twice a day to see results.
Inositol is an important amino acid which can have mood elevating effects or calming effects. So it can be useful in both with those with depression and those with anxiety. In anxiety, the doses would need to be in the gram range. Usually between 10 and 14 grams are needed to help establish normal mood changes for those with anxiety. Other very helpful nutritional products would include valerian root and chamomile. These are calmative types of herbs which have a relaxing effect upon the sympathetic nervous system, which is that part of the nervous system which causes excitation, which is overstimulated in anxiety. Not many studies have been done with ginkgo biloba in depression, but those of us in clinical practice have observed that ginkgo certainly does enhance mood, intelligence, and mental stamina. It probably works, again, by increasing blood flow to the brain, and it might also help those with depression by increasing the uptake of monoamines, which are chemicals such as tyrosine and epinephrine, which are needed for normal neurotransmission and nervous system function.
We now have herbs such as St. John's wort, and I think St. John's wort right now is the #1, in my book, it is the #1 treatment for depression. And in Europe, by the way, the prescriptions for St. John's wort over prescriptions for antidepressants is 20-1. The doctors are actually giving people St. John's wort 20 times as often as they're prescribing traditional antidepressants. One of the actions of St. John's wort is similar to the SSRIs, such as Prozac, which inhibit the reuptake of serotonin, which means that there is more serotonin left circulating in the brain. So it actually increases serotonin levels. It's an antidepressant that does not interfere, as some of them do, with what's called REM sleep or dream sleep. And we need dreams in order to properly function psychologically. And what St. John's wort does, it's not a sleeping pill. It's not something you take at bedtime and expect then to fall asleep, as you would say with kava. Kava would do that, or valerian. But what St. John's wort does is it helps regulate the brain to release its own factors that promote sleep. In fact, it's thought, there's some preliminary research showing that St. John's wort may release melatonin. And we know what melatonin does. Melatonin does enhance sleep.
Right now, St. John's wort outsells Prozac in Germany by 4-1. I think that the same trend that we see in Germany is going to occur in the United States as more and more people find the idea of an effective, over-the-counter herbal antidepressant appealing.
Now, it used to be thought that you couldn't combine St. John's wort with antidepressants and with many other things because it was thought to be an MAO inhibitor, which means it could have what's called the cheese effect, giving people bad headaches and high blood pressure, and can be very dangerous. However, that's not the case. So if you read that about St. John's wort, it's really been written with an idea that was once thought to be true and has really been disproven. So they do mix well. But what I do is put people on St. John's wort and start decreasing the antidepressant dose while increasing the St. John's wort, and after a month or so, they're totally on the St. John's wort and off of the medication, and again, it's quite a smooth transition. And I highly recommend doing this under your doctor's supervision. If you're on medication, you shouldn't suddenly stop it. You should do it under supervision.
Often, just giving a natural substance is not necessarily practicing holistic medicine. We need to understand what the causes are, what the deficiencies are, what the psychological issues are that have led to this state of depression or anxiety.
Exercise can increase a person's energy level and produce feelings of revitalization and accomplishment. A person who's having difficulty getting started can begin with simple movements. Once the effect of the activity is felt, it can be increased to a level and type appropriate for that individual. The exercise may consist of very, very simple things. Just getting out of bed and walking, getting up and doing some simple movements, some mild calisthenics, any kind of physical movement that gets the body in action. Another benefit of exercise is the feeling of accomplishment. Even doing a little bit of exercise will make you feel more energized later on. For the depressed individual, the boost to self-esteem that this can give is important. You can't wait until you feel good to do something, because in depression that may take days, weeks, months, or even years. You want to accelerate the process.
When we look at activity and exercise factors, once again, low serotonin, there's two different things that can increase the serotonin levels. One is quiet time, whether it's meditation, whether it's prayer, some quiet self-reflective time. For some people it's a walk in the woods, in the park. For other people it is just sitting down and reading. Those things we know increase serotonin. The other factor is if you are consistent in your exercise program to exercise at least 4 days a week consistently, you can increase serotonin if it's 20 minutes a day where you're getting to the point of aerobic or sweating sort of things. 20 minutes a day it takes. If you're going to skip and only be able to do 2 or 3, that's actually kind of negative, and we need that quiet time built in.
One of the most important things that someone who is depressed can do for themselves is to integrate their brain. Recent research out of Harvard Medical School shows that when a person is depressed, they're not accessing their left frontal lobe, which has to do with accessing details and high-level reasoning and logic, and also the right posterior parietal lobe, which has to do with three-dimensional spatial awareness. In remission, when a person is no longer depressed, their brain is what's called integrated. The most effective therapy that I have found is something called brain gym, which is simple physical exercises that anyone can do. They're lots of fun, and they were originally developed to help people with learning disabilities. Recent research has shown that people who do brain gym can change their neurology. They can change the way they actually use their brain and therefore be able to overcome even life-threatening, lifelong depression. This particular exercise is called brain buttons. It's one of the very basic exercises in brain gym. You come about chin width apart and rub your brain buttons directly underneath your clavicle, and you rub both sides. And it's been proven phenomenal for integrating the brain, and PET scans show that when you do brain gym regularly, it alters the way you use your brain. To do Cook's hookup, one variation is to do it standing up. You cross one leg over the other one arm over the other one, interlacing the fingers, and I like to fold my arms up and put my thumb underneath my lower lip, which is the end point of the central meridian, the central acupuncture meridian. So you're breathing in a specific pattern with the tongue to the roof of your mouth as you inhale, tongue down as you exhale. After about 2 minutes like this, Cook's hookup brought the electrical activity in the brain from the brainstem, the survival area, to the frontal lobes, which is the part of the brain that produces calming neurotransmitters like GABA, gamma-aminobutyric acid. And it's also the part of the brain where, when we're accessing our frontal lobes, where we can think logically and calmly. Now, the third exercise is called a cross crawl. When you're depressed, 65 to 75% of your non-dominant hemisphere is shut down. So, believe it or not, cross-crawling at least 5 times a day is one of the top things that somebody who's depressed can do. Now, when I bring my hand to the inside of the knee, I'm also stimulating the liver meridian, a point on the liver meridian. So I'm stimulating the electrical activity between the right and left hemisphere to help to integrate the brain. And when you cross-crawl, you want to cross-crawl at least 25 times on each side for about 1 to 2 minutes.
In psychoanalysis, the therapist helps the patient retrace his or her past in order to attain an understanding of the cause of the patient's irrational behavior. Whether this insight actually helps patients overcome such behaviors, however, remains controversial, and a wide variety of psychotherapies have developed that claim greater effectiveness than traditional psychoanalysis.
Instead of spending time with people, a person comes into a doctor's office and says, I'm miserable, I'm depressed, I can't move, I think my life is gone, I don't know where I'm going to go, and the doctor turns to a prescription pad and starts writing. That's the exact wrong response, because that's a response that denies, in a very deep sense, what the person is saying. And it means, you've got a disease, I'm going to give you a drug. And what that person wants first and foremost is for somebody to respond to her plight. So the first thing is you need to spend time with people. And you need to listen, and you need to see how the world looks from their perspective. Secondly, in being with people, you need to communicate some sense of hope, some sense of possibility that things can change.
Everybody should have several people in their life that they really trust. And when a person is feeling depressed, telling somebody exactly how they feel is really the first step on getting well. And in that process of telling somebody, either through feedback from the other person or through thinking it through carefully themselves, they can figure out what they want to do next to deal with the situation. So that, just that telling someone, and it's important that that person who's being told just listens, that they listen very carefully, but they don't interrupt with a lot of advice or nag the person with saying things like, come on, get going, you can do it, because this is very, very serious.
Trying to persuade a despondent person out of his mood may be futile. However, distracting the depressed mind has proven beneficial. The next step may involve doing some volunteer work, getting out and doing things for other people. This is very important in trying to get the depressed person's mind off himself or herself.
Let's pay attention to what we do. That's all we can really control, our behavior, the way we move our arms and legs and our mouth. Whatever we're feeling, if we act constructively, we're less likely to maintain that depression or anxiety. That's the one thing we can control. Accept your feelings as natural to you in the moment. Again, we like the weather sometimes and we don't like the emotional weather at other times. But if we focus on acting constructively, we're more likely to feel better than if we let the emotion drive our behavior and run our life.
According to Carl Jung, we can only live in the light by constantly being aware of where our shadow is. So it's no good to deny our real feelings. One healthy way to process anger is to get up every morning and time yourself. Spend no more than 5 minutes writing down what you're actually angry about so that you can make conscious, loving choices throughout the day.
When we talk about forgiveness, what we discover is that the person doing the forgiving is the person who gets all the benefit. It's not about the other person. It's about making peace with ourselves in an event. And very often what happens is what we're angry at is our sense of helplessness, our sense of hopelessness within that particular experience. What could I do? I was betrayed, I was hurt, this went on, I feel so angry about it. And what we have noticed in life is that there's an accumulation of toxic emotions and feelings.
In depression, it's not only a question of being agitated, but you also have a sense that you're out of control, that something else is running your life, some malign force, some almost a physical feeling of being pushed down, depressed. So I give them some kind of relaxation exercise, simple, deep breathing. Breathing into your belly, perhaps saying to yourself, soft belly as you breathe. So that's first. Second part, another part of dealing with depression is to help people become aware of what's depressing them. If you just feel overwhelmed, if you don't have any idea what's going on, that deepens the depression.
A lot of people that are caregivers, right? People always really sacrificing for themselves. They need to have a little bit of a diva inside of them, and this happens more so with women that I've seen. Not enough self-nurturing, not enough finding their own voice. That comes up repeatedly, and that's a low level of depression. In Chinese medicine, I translate that kind of understanding into what Chinese call deficient blood. It's a kind of vacuity and emptiness that people will have, but it's an emptiness of self. Not an emptiness in terms of not having love or being able to share with people, but it's an emptiness in terms of something that really roots them and keeps them healthy and sane and within their own personal domain.
For many of us, depression comes when we're down on ourselves, when we're criticizing and self-talking ourselves about what we should or shouldn't have done, when our self-worth is low. And the first gateway in everyday enlightenment is discover your worth. And it's not about pumping ourselves up to say, I deserve the best in life, and resenting the world for not giving us all we deserve. It's more a sense of recognizing our innate worth, that we do the best we can every day of our life with what we're working with, just as our parents did the best they could. Whether it was kind or cruel or sophisticated or abusive, they were doing the best they knew how with the wounds they had.
I believe that in order for people to heal, they have to embrace their wounds. And frequently they find gold in those wounds. The gold underneath it is covered up by the wounds. And I have found that by writing in a journal and by meditating and by using guided imagery, that those are three modalities that are very useful in helping people to get more aware, to have a higher level of understanding, and really get to the heart. And most of the wounding that we have has to do with self-esteem and really heartache. And I have found that by meditation especially, that it is such a strong connection of the mind going into the heart and the mind gaining so much inner peace that it's just a wonderful, wonderful way to assist somebody. And they feel that they are participating, and that really is a very empowering tool.
Particularly for people to feel so locked into their life and experience why is this happening to me, and they don't feel like there are any answers for themselves. Past life regression is really helpful in giving people an expanded notion of who they are and what they are. So I found that as being an important ancillary tool in helping people to break out of the reality they've set up for themselves. And that's the key. You're trying to get people to shift in terms of their reality.
When a depression gets very deep and we feel like ending our lives, it's often very hard to address the depression. It's very, very difficult to find something that's going to help. But when we're just beginning to be depressed, it's much easier. And that's the time when we may want to check in with our healthcare professionals and see what they suggest that we do. We want to take an extra long walk. We want to do some more breathing exercises. We want to make sure our diet is absolutely healthy, that we want to spend more time doing fun, creative activities. It might mean going out to some kind of an event with friends.
We have ways to influence our emotions. For example, we can influence the way we feel with our posture, sitting up straight, breathing deeply. Our breathing has an impact on our emotions. Our environment has an impact on our emotions. We can distract ourselves. There are many things we can do to affect our emotions.
We also need to, be more connected with nature and, smell the roses, as they say, and and get into plants and smell the fresh air, connect with Mother Nature on a regular basis, whatever way that you can.
Nature is healing. Nature is our mother. And the love of our mother, her bounty, her generosity, is healing for all of us, just the way the love of our biological mother can be very healing to us. And also for many people, being by water. I find that particularly healing for me. I often go on vacations by water. And what I find is I relax more, I sleep a little more, I just take it easy. And maybe it's because of the negative ions that are there close to water, maybe for many other reasons. I was talking with a colleague of mine, a traditional South African healer, and I said, what do you do when somebody's depressed? And he said, first thing is we have them go sit by a river, by running water. And I remember as a kid, sometimes when I'd be kind of melancholy, I'd go over to the East River and just watch the water, and that would help to heal me.
Enjoy and reflect on all the positiveness that we do have in our lives on a daily basis, whatever it is, the simplest things, whether we're walking or seeing something or tasting something or smelling something, you're paying your bills, or whatever it is, you need to look at that. And when you start looking at the list, you may say, wow, you know, I have a lot of wonderful things going on in my life. And that's what we need to do, is we need to focus on the positive.
Do something to break yourself out of your current mood. I have people get up and shake. Just stand there and shake for 10 or 15 minutes, or even 5 minutes. So you're breaking up a fixed pattern. Or make faces at yourself in the mirror. Break your own seriousness. Seriousness, is the great disease of adulthood in our society. Everybody thinks they're so important. Everybody thinks, oh my God, my life, this has to be done, that has to be done. And what they wind up doing is shutting themselves down. So anything you can do to break the pattern, just do something different. Or go see a funny movie. But best thing is to spend time with children. They'll take you out of yourself, and you'll start to recover that sense of what it's like to be a little more spontaneous, a little less preoccupied with what other people think.
There are many ways to serve our world, but in focusing on other people and turning our attention outward and asking how we can make a positive difference with a kind word, a smile, writing a note to a waiter or waitress who has done a good job. These kinds of things help pull us out of ourselves and actually raise our sense of self-worth and raise our spirits. So that's the final solution, if you will, to anxiety and depression, to focus on helping people around us. As we uplift our world, we can't help but uplift ourselves.
How can anxiety be treated naturally? When alternative treatments for anxiety are used effectively, they don't just relieve the patient of the problem, but lead that person down a path to greater overall health.
Anxiety is a generalized form of fear. Now I've done the big fears, the bungee jumping, the skydiving, the high ropes courses, the firewalks, but those fears are much less important than the ones we face every day. Expressing our feelings, speaking before groups of people. For some of it's just going outside. Fear is a wonderful servant, but a terrible master. Many of us in our life, when we look back, we regret not so much what we've done, but what we haven't done. And often we haven't done because of fear, because of anxiety. We don't take a risk and start a new business. We don't ask for that date. We don't learn to speak before groups of people. We don't do any number of things because it makes us feel uncomfortable. But the choice remains for us. The power always remains with us, again, to reclaim our will and to choose how we will act despite feeling uncomfortable.
There is a new set of components of a new treatment called cognitive behavior treatment. And in order to help from a behavioral point to overcome that fear, we engage in what's called interceptive exposure, which is engaging in little exercises that produce symptoms similar to the ones in a panic, which are repeated till the person no longer fears them. For example, to induce dizziness and lightheadedness, the person might shake their head back and forth. We might have them spin for a minute and then stop and then walk with it. or the person might breathe through a thin cocktail straw for 2 minutes, which constricts the breathing. And hopefully later, when they have the same types of symptoms in a panic attack, they won't be afraid anymore. So we want to make change at a deeper level, and the way we arrive at that, for example, there's different strategies, but one of them is that the person needs to first of all become aware of their automatic thoughts. And automatic thoughts are thoughts that come easily to one's mind. For example, if I feel that I have difficulty breathing in a panic attack, my automatic thought might be, I will suffocate. Or if I feel lightheaded and dizzy, I'm going to faint. And as I mentioned earlier, as long as the person believes those thoughts, those automatic thoughts, they keep frightening themselves. So the first step was to become aware of the automatic thought. I might also ask the person, how strongly do you believe that, on a scale from 0 to 100%? Then I will ask the person, what is your evidence? How did you come to the conclusion that you will have a heart attack or a stroke, or you will faint, or you will go crazy or lose control? And then they will give me an answer. Then I will ask them to refute that. In other words, they are probably falling into what's called a cognitive trap. They are entrapping themselves. And through cognitive behavior treatment, we teach the person to learn certain skills and ways of thinking that will help them, that will empower them, and hopefully not just for the moment. Relapse prevention is a big component of the treatment as well, so the ideal is for the person to leave the treatment with the tools to keep helping themselves afterwards.
Dr. Doris Rapp has been able to help so many children who otherwise were labeled as depressed or anxious or attention deficit disordered, but indeed were not. They were simply suffering from imbalances.
When you see a youngster who's reacting in a set pattern, you recognize the early clues. It means that the answer isn't a better drug, a newer drug, a more sophisticated drug. The answer is to sit back and say, why? What did I eat? What did I touch? What did I smell? What is it that could be causing me suddenly to feel so anxious and nervous and depressed? And you can figure out the answers, not only in yourself, but in your child, by just saying what's different. And if you start to do that, you'll find that you won't need these drugs that have so many potential bad side effects. I'm not saying that sometimes drugs aren't needed, because sometimes they are. But I am saying that if you can find and eliminate the cause, you won't need the drugs. Ritalin, for example, is prescribed as if it's water. Well, that drug is a class 2 narcotic. It's not water. If your child can go on a diet for 3 to 7 days, and your child is perfectly normal, and the second week you add the various foods back, and a certain food makes your child hyper, and another food makes your child agitated and aggressive, maybe you ought to think about the fact that you should take the foods out of the diet. Or maybe you should obtain allergy testing and treatment for those particular foods. It's time we put common sense back into medicine. We have to find out the causes. Don't mask everything with the drug, because on a long-term basis, you're going to stop the drug and you've still got the same medical problem.
There's good research that's been done in Scotland by Dr. David Horobin that shows that children who were not breastfed for at least 4 months, who were on formula, who did not get all the fatty acids their brain needed, but who got only the precursors in their formula, often became more anxious and hyperactive as children, and that they were the ones who were often diagnosed as suffering from ADHD, attention deficit hyperactivity disorder. And by giving them the right fats, they calmed down, they were able to focus, they were able to pay attention, which is a Vatic problem from the Ayurvedic perspective. His product contained fish oil, vitamin E, and evening primrose oil, and contained all of the basic fatty acids that your brain needs to function.